Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Cystocele Surgery. Introduction. A cystocele happens when the bladder starts to fall back and pushes against the front wall of the vagina. If you have a cystocele, your healthcare provider may recommend that you have surgery to correct this condition. This program explains the operation to correct a cystocele. It discusses what a cystocele is, its causes, symptoms, and alternative treatments. It also explains the risks and benefits of the procedure. Anatomy. The reproductive system is located between the urinary system and the intestinal system. The urinary system is in front and the intestinal system is located behind the reproductive system. The female reproductive system consists of 2 ovaries, fallopian tubes, the uterus, and the vagina. The fallopian tubes connect the ovaries to the uterus, and the vagina connects the uterus to the outside of the body. The urinary system consists of 2 kidneys, the ureters, the urethra, and the bladder. The ureters connect the kidneys to the bladder, and the urethra allows the bladder to empty. The intestinal system ends in the sigmoid colon, rectum, and anus. The front or anterior part of the vagina is close to the bladder. The back or posterior part of the vagina is close to the sigmoid colon and rectum. There is an area of tissue known as the fascia between the anterior part of the vagina and the bladder. The fascia and the muscles of the vagina prevent the bladder from pushing into the vagina. Cystocele. A cystocele happens when the muscles of the vagina and the fascia between the vagina and the bladder can no longer keep the bladder pushed to the front. When the muscles of the vagina, along with the fascia, can no longer keep the bladder in place, it starts to fall back, pushing with it the anterior wall of the vagina. Childbirth can lead to cystocele because of muscle straining. Other kinds of straining can also cause a cystocele. For instance, lifting heavy objects and straining during bowel movements can cause a cystocele. Cystoceles are divided into grades 1, 2, and 3. In grade 1 cystocele, the bladder barely slips into the vagina. In grade 2, the bladder falls farther and reaches the opening of the vagina. In grade 3, the bladder comes out of the opening of the vagina. This can lead to trouble emptying the bladder and discomfort. When the bladder does not empty completely after urination, the urine that stays in the bladder may get infected. Urinary tract infections can lead to frequent and painful urination if not treated. This may also lead to the spread of infection throughout the body. Stress incontinence means urine comes out at the wrong time. This can happen when a woman sneezes, coughs, or laughs. A cystocele may also cause problems and pain during sex. In its most advanced form, vaginal sex may not be possible.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Diagnosis. Grade 2 and 3 cystoceles are easy to diagnose. The bladder can be seen in or outside of the vagina. Avoiding cystourethrogram is a test that involves taking X-rays of the bladder during urination. This X-ray shows the shape of the bladder and lets the healthcare provider see any problems that might block the normal flow of urine. More testing can be done to find or rule out problems in other areas of the urinary system. These could include cystoscopy, where the healthcare provider looks at the inside of the bladder with a specialized scope. Urodynamic studies, which allow your healthcare provider to study how well the bladder empties. Alternative treatments. Grade 1 cystocele may not need treatment. A severe case of grade 3 cystocele might need surgery. As long as the cystocele is not causing pain or discomfort, you may only need to avoid heavy lifting and straining. This can help keep the cystocele from getting worse. A set of pelvic muscle exercises known as Kegel exercises may help strengthen the muscles of the bladder and vagina and relieve some of the symptoms. For a woman whose cystocele causes pain or discomfort, you may want to try a pessary. This is an object that goes in the vagina to keep the bladder in the right place. There are many sizes and shapes of pessaries. This makes them comfortable for patients. You should take out your pessary on a regular basis to prevent infection or ulcers. Surgical treatment. Large cystoceles may require surgery to push the bladder away from the vagina and support it so it will stay in a more normal position. Cystocele surgery is an inpatient surgery. This means you will be spending a few days in the healthcare facility. The procedure usually takes 1 to 3 hours. The operation is done under either general anesthesia or regional anesthesia. Under general anesthesia, you will be asleep for the surgery. Under regional anesthesia, the pelvic area will be numbed and you may still be awake. The operation is performed through the vagina. The front wall of the vagina is opened. Next, the fascia between the bladder and the vaginal wall is reinforced. This is either done through specially placed sutures or with the help of a synthetic mesh. The surgeon may place a sling around the urethra to hold the bladder in place. This can help with incontinence. If the vagina is deemed to have stretched too much over time, the surgeon may decide to trim some of the excess tissue and the incision is then closed. The sutures in the vaginal incision can be absorbed by the body and do not need to be taken out. During and after surgery, a Foley catheter will be placed in the bladder to drain the urine to the outside through the urethra. Some surgeons place a tube that connects the bladder to the outside through the front of the abdomen. This is known as a suprapubic catheter. After the operation, you may spend an hour or two in the recovery room before being taken to your healthcare facility room. You will be asked to get up and walk fairly soon after the operation. The bladder catheter is usually taken out within 1 to 2 weeks if you have no problems urinating. Risks and complications. This procedure is usually successful and safe, but there are several possible risks and complications. These are very unlikely, but they are possible. You need to know about them just in case they happen. By being informed, you may be able to help your healthcare provider detect complications early. The risks and complications include risks related to anesthesia, risks related to any type of surgery, risks specific to this procedure. Risks of general anesthesia include nausea, vomiting, problems with urination, cut lips, chipped teeth, sore throat, headache. More serious risks of general anesthesia include heart attacks, strokes, pneumonia. Your anesthesiologist will discuss these risks with you and ask you if you are allergic to certain medications. Blood clots in the legs can happen after surgery. These usually show up a few days after surgery. They cause the leg to swell and hurt. These blood clots can come loose from the leg and go to the lungs, where they can cause shortness of breath, chest pain, and possibly death. Sometimes the shortness of breath can happen without warning. It is extremely important to let your healthcare provider know if any of these symptoms happen. Walking shortly after surgery helps to decrease the risk of blood clots in the legs. Some risks, such as infection and bleeding, are seen in any type of surgery. Infection can happen in the vagina or bladder. Infection can be treated with antibiotics. Rarely, another operation may be needed. Bleeding can happen either during or after the operation. If needed, blood can be replaced through a blood transfusion. The vaginal incision is not seen from the outside and tends to heal very well. Sometimes the operation causes the vagina to become too tight. This may cause vaginal intercourse to become painful or uncomfortable. This is rare. In extremely rare cases, nerves going to the reproductive system may be affected, which may result in sexual dysfunction. Other risks and complications are specific to this surgery. These include the possibility that the cystocele may recur with time. This type of surgery may not improve stress incontinence, and additional surgery may be needed. If you had a sling placed, it may erode the tissues in the vagina, urethra, or bladder. This requires another surgery. The bladder or ureters could be injured during this operation. If the injury is identified during surgery, it can be fixed with no further problems. Small bladder injuries may go unnoticed and may surface later requiring another surgery. Such an injury may show up in the form of urine leaking to the outside through the vagina. Problems controlling your urine may also happen. Other abdominal organs, such as intestines, blood vessels, and nerves, could possibly be injured, but this is very rare. After the operation, bloody discharge from the vagina for a few weeks after the operation is normal. Bright red and profuse bleeding or foul-smelling discharge may not be normal and should be reported to your healthcare provider. You should refrain from any heavy lifting or bending for at least a few weeks. Your healthcare provider will also tell you how long to refrain from vaginal intercourse. Your healthcare provider will also tell you when you should schedule a follow-up visit. Call your healthcare provider and seek medical attention if you have a fever, chills, severe abdominal pain, inability to urinate, profuse vaginal bleeding, or foul-smelling vaginal discharge.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. A cystocele happens when the bladder starts to fall back and pushes the front wall of the vagina. Childbirth can lead to cystocele because of muscle straining. Other kinds of straining can also cause a cystocele. For example, lifting heavy objects and straining during bowel movements can cause a cystocele. Grade 1 cystocele may not need treatment. As long as the cystocele is not causing pain or discomfort, you may only need to avoid heavy lifting and straining. This can help keep the cystocele from getting worse. Large cystoceles may require surgery to push the bladder away from the vagina and support it so it will stay in a more normal position. Your healthcare provider may recommend cystocele repair surgery. Though it has risks like any other surgery, the cystocele repair operation is generally very successful and safe. Thank you for using Explain.